Morning, everyone. Happy Hump Day, and welcome to the news agenda with me, Fleet Street Fox. And today I'm joined by the Mirror's politics reporter, Dan Bloom. And we're going to go through all the biggest stories of the day. We're going to tell you something that will enrage you even more than Boris Johnson, if that's possible, right at the end. So stick around. Now, through it all, we want you to ask us your questions, dig into the comments, and ask us whatever's burning a hole in your head, and we'll do our best to help you with them. So let's get stuck into it. We've had the worst round of redundancies since records began, with 370,000 people losing their jobs in the last quarter, most of them hospitality and retail. That's 250,000 people more than this time last year. Meanwhile, there are hospitals filling up, and with medics and specialists uniting today to call on the PM to rethink his relaxation of the rules over Christmas. So why, with just a week to go until the big day, is Boris Johnson only now starting to realise that letting families mix at Christmas might backfire? So, Dan, you're in Parliament, you're there in the lobby, you're near number 10 in conversation with them. What are the chances of that happening?
Well, it looks like the chances of the law changing, so this law that you can have 3 households for 5 days, seems quite low. And the reason for that is that it's only a week away, and the kind of political consequences of cancelling Christmas are seen as, rightly or wrongly, kind of a bad thing, just as the political consequences of a load of people dying over Christmas seen as bad. So what we'll see instead, it seems, is that we'll be told, even though you're allowed to do it legally, don't do it if you can help it, which is exactly the sort of mixed messaging the government has been criticised for in the past. We might have people told, if you've got elderly relatives, think again, travel local instead of, going 500 miles across the country like Dominic Cummings, and things like just kind of other measures like stop seeing people now, which was already sort of advised if you're going to go and see family before Christmas, to kind of lessen the chance that you have picked something up.
Right, okay. Now, as Jemmy says there, no one can cancel Christmas. They can, in theory, Jemmy, especially if they're in hospital. That tends to put a dampener on things. But surveys are showing that a third of people, 31%, about a third, think like Jemmy there. Like they just want to have Christmas and they don't care about anything else, and they need to get together after a hellish year in which they haven't seen their loved ones. But 57% of people want Boris Johnson to tighten the rules. So while he's not going to change the law, what are the chances of, say, the tier restrictions altering in some other way? How else might he tighten things up?
Well, that one could be interesting because we've got the tiers being reviewed for the first time, or it's meant to be the first time today. And we'll probably get an announcement on that tomorrow, maybe tomorrow late morning, House of Commons. And that means that all these sort of millions of people who are in tier 3, mostly across the North and the Midlands, but now in London and the Southeast as well, will be told whether or not they're moving down a tier, and a load of people in tier 2 will be told whether they're moving up a tier. Now, the problem with that for Christmas is that you could tighten up the tier rules for Christmas, but a lot of people are already in tier 3. It's well over half of England. It's 34 million people. So for those people, unless you change the tier system itself, which will look like political failure because it's only been 2 weeks, you can't really tighten up the rules ahead of Christmas any more than they already are.
Exactly. Now, as Danielle Pickett points out there, how can you travel to work but not to your family for Christmas? It's contradictory. In a way, Danielle, yes, because you're moving about, you're potentially spreading the virus if that person who's moving has the virus. However, if they don't have the virus, you can go to work, and probably your work is got a degree of social distancing, lots of hand gel, and you're very aware of what's going on around you. When you go to see your family, you're locked in a building with poor ventilation, and you are less likely to be, you're more likely to be relaxed and more likely to perhaps be picking it up from other people. It's not so much a case that the individual going to work or home might be spreading it. In fact, they pick it up and then go to work and spread it at work as well. So they can appear contradictory while sometimes being a bit more sensible. Now, I said ages ago that I could see, just from my journalistic experience, at some point in the new year, a newspaper carrying a picture of a big family dinner, right, with every person who died subsequently ringed in red, and the headline, Last Christmas. Because you can just predict it happening. Even if it happened to one family, the newspapers would find them, and that would be the story. And that's kind of the thing that Boris Johnson is going to be calculating here, Dan, isn't it? How much of this, whatever he decides to do, if he tightens restrictions or if he lets it go ahead, however many deaths there are, how many of them get attached to him in terms of the blame?
And this is exactly the dilemma that they face at the moment, because, I mean, look at Dave Oakley's question. I haven't seen my grandkids for many months. The only way they'll stop me is to imprison me. That's exactly the problem that they have got. They've got people on one side saying cancel Christmas, and a lot of people like Dave who are saying some things are more important than following the letter of the law. That's why they're saying, we won't imprison you. It won't be illegal to go and see your family, but they are advising against it. So I think there's also a feeling in government that there are a lot of people, a few million people like Dave, who, even if it was against the law, they would go anyway. And that would then kind of water down people's belief in the rules even more than they have been already, and people would be more likely to break the rules in future. So it looks like they're going to allow it, but say, look, try and get people to self-police and say, just don't do as much as you possibly can.
Yeah. And Dave, it may be worth remembering, everyone can understand your wish to see your grandchildren and how difficult it is to be separated. There are many millions of other people who are intentionally spending a Christmas, despite the fact the rules say they could spend them with family, intentionally not doing so. So there are people with the opposite view, and they're also suffering in just the way you think that you can't. And there's two sides to everything. Now, Robin says, I work in healthcare, in a residential care setting. I've done way since way before this mess. My mum died in June. I've inherited her house in Surrey. Am I allowed to keep going back and forth between our houses? Because he's obviously got to sort it out. He's got to tidy up her things. He's got to go through the grieving process as well, which means going through her stuff. What are the rules there, Dan? Can he do that?
That's difficult. So if you are in tier 3, Robin, if you're, say, in London or in Kent, then you're not meant to be travelling outside of that area except for a sort of essential reason. Now, that's not actually the law, it's just guidance. So there's no law stopping you from going to your mum's house in Surrey as long as no one else is there at the time and you're not mixing with another household there. So you can go, but if you're in London or another tier 3 area, the advice is you shouldn't if you can help it. I know that's not very helpful, but that's what the advice is.
Yeah, it's a case of whether you think you could convince a policeman that it was an essential trip. For example, keeping an eye on your mum's property if it's empty, something like that. Now, the Mirror's page 4-5 today has got a lot of different stories on it about this mutant strain that's going across the UK now. It's been found in Wales, or that started in the southeast. It's not more deadly, but it's more infectious. There's a medic at the bottom of the page there, Dr. Catherine Henderson from the Royal College of Emergency Medicine, who says that to relax now is to make everything we've done before a waste of time. This is the wrong spread. But anyway, we've also got this spread later on. This is the 6-7 spread, which is talking about the Mirror saying that saving lives is more vital. But, you know, we've got perhaps 80,000 excess deaths by the end of this. And we've got Dr. Mike Tilsley and another doctor there on the main spread who's talking about if they were to tighten the rules, people like Dave that we've just spoken to are going to have a complete lack of trust in the government. Trust which has barely been built back since the Cummings debacle. How can Boris get through it? I actually feel sorry for him. I think he's got a bit of a Hobson's choice because he can't win either way.
Yeah, and just our readers talking to us as well. There are clearly two schools of thought on this, and it doesn't matter whether the population is split equally, what percentage is what, the population is split. And a lot of people can see the benefits of both arguments. You know, there is a huge mental health crisis here for so many young people, think people in their 20s in a house share who are 100 miles away from the nearest family, who will be on their own if Christmas comes round, or in a sort of bedsit or something like that. That is a very different situation to someone who's in a care home or someone who has their nuclear family with their 2 kids and a dog. There are so many situations here. And that's why he's trying to fudge it by saying, you have this legal freedom, but please don't do it if you can help it. Problem is that we've seen that fudging it in the past kind of means that people will take what they think is sensible, and it may be, but as a population as a whole, it means that the virus spreads. It's no one's fault It just is the basic maths of the virus. Very difficult.
Yeah, and it's a case of anyone who does meet up and does get infected then goes to their hospital. Now, the hospitals are far more likely to get you better and get you out again now because they know so much more about the illness and how to treat it. But they don't have more beds. They don't have more staff. And their staff are also going to be getting this new strain and the existing strain and not being there. And we need them now as well to administer the vaccine. Now, Lucy asked, lockdown doesn't do anything. Didn't you see that from last time? I think the evidence and the stats, Lucy, are very much showing that lockdown worked because there was a drop in cases afterwards. And it's the drop in cases, not the eradication. Lockdown was never about eradicating COVID, Lucy, if that's what you think. It was about bringing the cases down below the point at which your local hospital would have bodies piling up in the car park. And if you didn't see bodies in the car park, then it worked. Because that's the thing. If it works, you see no evidence of ever needing the thing that had to be done. If it didn't work, then you'd be, furious. Now, Dan, there was going to be some talk about a press conference today or an announcement about the tiers system, but it looks like that's all in abeyance and they're not going to tell us when or if they're ever going to announce any changes.
This is the problem we have every morning as political reporters in this place. It's just the basic, what time is a press conference? Are we having a press conference? Please tell us what's going on. Today, we don't know what's happening yet. They had promised 2 press conferences a week, but that was during the national lockdown. So that kind of bet is off now. What we do know is they're reviewing the tiers today beyond, London and Essex that were announced earlier this week. We should get an announcement, but the announcement might not be today. The announcement might only be tomorrow morning because it takes time to kind of work these things through and they're doing the whole of England at the same time. So we don't know quite when it will be announced or whether there'll be a press conference this evening. I'm sorry, Susie, that's pretty useless.
Well, yeah, welcome to the government. Now, we think as well that perhaps Scotland and the other devolved nations might do something different, which is going to completely put the kibosh on everything. If you have borders, in between your family, obviously you wanted to cross a border for seeing your family at Christmas. Carol says, okay, Christmas is once a year, but COVID is taking lives. Quite right. And that's what many people are considering to be the important thing, and getting together at Easter or getting together next summer or something instead. One thing that's worth bearing in mind, I've said it before and I'm going to keep repeating it, when you do go home, if you do go home at Christmas, the most likely place you can catch COVID in a house, if you're going to see your parents or something, is in the bathroom, right? It's where people pick their nose, scratch their bums, sneeze, cough, and they don't always wash their hands because people can't see them. So if anyone's coming to your house, make sure clean towels and the surfaces are wiped down in between every use, including the flush handle on the toilet, okay? Now, little public health message for you there. Now, Lynn says, we have 15 planned for Christmas. Gosh, and 5 friends to call round on. I've paid for a goose and a turkey, and it's been organised. None of us care if we catch it. I pay for my health insurance anyway. Okay, Lynn. I hope that you've got your funeral plan covered. I think probably someone like you, it may be less likely to catch it. I don't know. But I'll tell you something, Lynn. I was reading a book written in the 1680 something by Daniel Defoe called Diary of a Plague Year, which was about the Great Plague of 1665. And he said that the people who were locked down they were literally locked up in their houses in that time. And the people who broke out and ran about London and said, we don't care, we'll be fine, they were the ones that died. And it's the same now. I hope it doesn't happen to you, Lynn, but you can follow the rules, please, and be careful about your hand washing and your social distancing. You don't have to call round on 5 people and go in their houses. You can stay outside. You can go for a walk with them. There's other things. Danielle says, I'm confused how you can estimate it'll be safe for Easter. What's the difference from Easter to Christmas? How does COVID have a time frame? I think partly this is due to the weather and the vaccine, isn't it, Dan? What do you think?
It's those 2 things mainly, really, because as we found, remember when we had the lockdown from March to about June or July, and then they lifted it, and for a long time, for a couple of months, things were okay, and that's because there's a seasonal element, just basic things like UV light kill the virus faster than if it's in the dark, and obviously in the winter there's hardly any light, so that is one of the bases. And also that by Easter, if everything goes well, we could have kind of up to about 20 million of the most vulnerable people vaccinated, and that is what they're claiming is that that would stop kind of 99%, as much as 99% of the people who would die from COVID. So even though more than half the population still wouldn't be vaccinated, they could choose to kind of row back on the rules so that people like our previous commenter who's having a big party for Christmas would be more free to do something like that without knowing that they might get the virus and they might die, but that the chances of dying is smaller than it would be otherwise.
Exactly, because it's having all these underlying health conditions that mean you're more likely to be hospitalised with COVID and therefore causing NHS all these problems and bodies piling up. Christine says, my husband's entire family live in Guernsey. We can't go home. Don't know if we're not allowed in. My mum's in a care home. We are still not allowed window visits. We'll stay home alone this year. I think you're writing in a bit of a hurry there, Christine. So sorry if I didn't catch the meaning of it entirely, but obviously I assume you live somewhere other than Guernsey and you can't go and see the in-laws and you can't go and see your mum, but you're going to be alone this year. I don't know whether you're happy or sad about it. I mean, I'm in a fortunate situation in that as a single parent, I can bubble with my parents who live down the road. So they've seen their granddaughter throughout the pandemic and I've seen my folks and they've seen me. But if I was in a couple and we couldn't see them, they're just a few miles down the road and I would be torn at Christmas as to whether we were going to find some way to get around the rules. What about you, Dan? Have you got plans for Christmas?
I think I'm driving down on Christmas Day because my parents are only about an hour away and we're just having Christmas lunch, but sort of half outside. They've got a patio. So I think we're going to get our coats on and have it there and go for a walk rather than like settling down and sitting in the living room because they're quite worried. They're in their 60s. They're worried about getting it.
There are a lot of people who are. And Kelly seems to be worried about something else here. Flu's been deadly for years. Not quite as deadly as COVID. It is definitely deadlier. And we've never been forced to have a flu jab. No. And you're not being forced to have a COVID jab. So why is this COVID jab go into control and be forced to have it and face having no job or holiday, etc.? You're not going to be forced to. And the talk about perhaps not being able to do other things as a result, I think has been kind of knocked out of the park, Kelly. Dan, can you reassure her?
The government is saying they won't withhold things from you if you don't have the jab, and they're not going to force you to have the jab. I think what Kelly is talking about is if private companies like airlines and bars and that sort of thing say you can only come in if you've had the jab once it's kind of rolled out fully, which is a long way in the future. Now, I mean, the problem is that private companies, to a certain extent within the law, can do what private companies can do. You can imagine there being some kind of high court case with someone like Kelly down the line, can't you? Saying, well, this bar didn't let me in or this airline didn't let me go on holiday because they didn't have a vaccine. That's discrimination, that sort of thing. So be interesting. What I say about flu, though, is the Chief Medical Officer, Chris Whitty, has been quite clear on this, that yes, thousands of people do die from flu every year, but COVID is obviously more deadly than flu. There are people who've kind of made that comparison, which Kelly isn't making here, and that's not right. But we might get to a position where we live with it as a country that a few thousand people, 10,000 people, what have you, per year die of COVID in the UK, and that's just something that we have and we manage. But we're not at that point yet. So it's not like they're going to kind of keep these restrictions till every single person is vaccinated and there are 0 cases. They've acknowledged that we're never going to get rid of this now. It's about managing the deaths to levels that it doesn't increase exponentially and kind of run out of beds in the NHS.
Yeah. And if we reach that point, Kelly, it'll be because the virus has weakened over time, which is what they often do. Now, Wendy says, hi, Wendy, scaremongering since the beginning. Nothing has changed. Nothing will change until the government achieves what they set out to do. The vaccine apparently can change our DNA. What's that all about? And 7 question marks. I'll tell you what it's about, Wendy. Shall I? Okay, I'll do this. The vaccine doesn't change your DNA. The DNA is the bit in your cells, all right, which gives the cells the instructions about what to do. And it then sort of does the equivalent of sending a text message to another bit of the cell with what's called messenger RNA in order to actually create the meal, right? So the DNA is the recipe and the RNA produces the actual meal according to the instructions in that recipe. What the vaccine does is it takes a bit of coronavirus the RNA, which is how the coronavirus replicates. And it is about the way to produce the spike on the outside of the virus, right? Not the virus itself, just the spike. And so the vaccine tells your body basically how to manufacture these spikes. And it just sends that message, that recipe, not anywhere near your DNA. It just sends it to the messenger RNA to create the spike. And then your body sees the spike, recognizes the spike. And if you ever catch coronavirus, stamps on it, gets rid of it. So you're never infectious, you never suffer, and the virus never gets to replicate, and it doesn't spread around the country. It genuinely does not change your DNA. It doesn't enter your DNA. It doesn't alter your body's functions, apart from to teach your immune system how to recognize what the damn thing that's going to kill you looks like, which, frankly, Wendy, I'll be delighted about. What about you, Dan? Are you going to take the vaccine? Do you think you're in politics? If it's all a big conspiracy and this is all a way to control us and it's all scaremongering, you should know, right, not to take the vaccine, if that's right.
Well, I'll be taking the vaccine when I can, which I suspect is a long way in the future, because I'm not in any kind of priority group at all. But yeah, I mean, you do get conspiracies in government, of course, but I think you get, how can I say this politely, foul-ups far more often than you get conspiracies in a lot of cases. And something like a conspiracy over a vaccine is just, you know, first of all, there is so much evidence from scientists, you know, to the contrary, and secondly, there are a lot of people who have sort of vested interest. I'm not talking about our readers at all here, but you know, in pushing these theories online and in undermining faith in this sort of thing, which blurs the lines between kind of truth and untruth and makes it a very messy game.
Yeah, and unfortunately, our readers and viewers see this elsewhere online, and it takes root in their heads and it comes out, which is why we try to tackle some of it in these Facebook Lives. Now, there is something perhaps which is at the heart of all this, Dan, something which is underneath our inability to quite get our head around things properly. And it's the final story of the day I want to discuss, which is there is a survey about the greatest chocolate bars of all time. They asked 2,000 British adults, and they came up with a list there of chocolate bars: Kit Kat, Galaxy, Snickers, Marathon, Crunchy, blah, blah. There's no Mars bar. This is what's wrong with Britain today. There's no Mars bar on this list. What's wrong with them, Dan?
There's no Twix either. What's going on? I mean, Bounty needs to be out there for a start. Everyone knows that. In my opinion, Crunchy too. I mean, Crunchy doesn't belong in there, personally.
Where's the double decker? Britain, why aren't you using Mars bars, Twixes, double deckers? And frankly,
I like a Boost actually, because it's kind of like getting an adrenaline shot. There's so much sugar that I feel like I'm going to have an instant heart attack. But that one's not for everyone.
I always tell myself that a toffee crisp is actually a bit of a meal because there's more than one food group in it, and I'm not entirely sure that's right. Anyway, thank you, Dan, for joining us. Thank you, everybody, for listening and taking part. I'm afraid we've got to leave early because Dan's got to go and do at 9:30. But thank you for watching. Thank you for taking part. And we'll see you all again next Monday for the news agenda. Bye-bye.